Hey Bionic fam, it's Chris Lopez here. Today we are jumping into content that will cover, I think, what would be very helpful for us as people who have underwent or going to undergo orthopedic surgery. I went to artificial intelligence to get today's topic, and I typed in on ChatGPT, what are the top 10 frustrations that people have when returning to exercise and sports after major orthopedic surgery. The list is pretty good. So stick around, we're going through it one by one.
Sometimes life just gets tough. So let's get through it together. I'm Chris Lopez, and this is Bionic Living.
Again, my name's Chris Lopez. This is my channel, Bionic Living. I put up videos as often as I can to help others who are going through or who have gone through major orthopedic surgery, specifically back fusion or joint replacement. Today, I went to ChatGPT. It's hard for me to say, ChatGPT. I'm utilizing it to help us talk about some of the main frustrations that we're probably having when we're recovering from surgery and getting back into our athletic activities or exercise. So I put in top 10, and this is what it gave us. Number 1, slow progression. Regaining pre-surgery levels of strength, flexibility, and endurance can be a slow process. This gradual improvement can be frustrating for those eager to return to their previous level of activity. And I agree. For me, it was hard after the first surgery, but then I had 3 more, so I learned to be patient really quick. But that is my biggest recommendation after surgery is to take your time. Don't push it. Rest. People are always so proud to say, I was walking blocks 2 weeks after surgery. Just wait. If you can, great. If you can't, don't beat yourself up. I recommend to give yourself a year before you're back and feeling good and doing things carefully. But learning, healing is a sine wave, so you're going to have good days and bad. So just take it slow. And that is the number 1 frustration, according to ChatGPT, is slow progression. And I think it's just fine as long as you're progressing. Okay, number 2, fear of re-injury. This is me. Worrying about re-injuring the affected area can be a significant barrier. Athletes often fear they might aggravate their injury or suffer a new one, which can make them cautious and hesitant. Well, I'm too old to be an athlete anymore, but the fear of re-injury is tough, especially if you had something like an Achilles tendon rupture or a tear in the joint. But a lot of times with the joint replacements, you'll find that your activities are just so much better because you have motion again. This is a pretty typical one and understandable. Ready for number 3? Number 3, pain and discomfort. Experience pain or discomfort during or after exercise can be discouraging. It can also hinder ability to fully engage in activities. I still have a horrible relationship with my pain. If I have pain even in an area that hasn't had surgery, it just really gets to me psychologically. And this is where I've always recommended utilizing a behavioral cognitive therapist, which I wasn't for a while, but now I'm back in. I'm having some shoulder pain, and it's kind of layering over all aspects of my life, from personal relationships, professional, and thus forth. So pain and discomfort, it's a very, I think, the AI has it right. That is a big one. We don't want to be in pain, and we want to be comfortable in our lives, but it's just, I think, something that we have to accept and manage. Number 4, limited range of motion. Well, after joint replacement, this one isn't so bad, is it? We have a new joint. Usually that motion is way better than it was over the many years that we've had the original joint. But then when we talk about back surgery or back fusion, that's when we worry about you can't touch your toes. I can touch my toes better than I could before the back fusion, I will tell you that. But it says here, restrictions in movement or stiffness in the affected area can impact performance and technique, making it difficult to perform exercise sports activities as before. I think with a lot of therapy, proper adjunctive things like Pilates or yoga, and depending on your age, what you're doing is if you're just going to get out and walk miles, hopefully that reduced mobility isn't too hindering, or it's not something you're too frustrated about. Number 5, and I think this is mainly for like high level athletes, returning to activity is adjusting technique. The need to adapt or modify techniques to accommodate for new physical limitations or to avoid putting undue stress on the affected area can be frustrating, especially for athletes used to a specific way of performing. For example, right now I'm having shoulder pain, shoulder problems, and I can't swim right now. And I mean, I can if I do a breaststroke or a backstroke, but I can't do a front crawl. But I want to do a front crawl, but I have to adjust. So I'm frustrated, and I have to adjust my technique. How many of you out there are having to adjust your technique? This is a good one because I want to see what you all are doing with your activities and how it's getting affected and how you're adjusting, because this is one thing I'm definitely struggling with right now. So if you're adjusting technique in your recovery or return to activities, comment below. What surgery did you have? And how are you getting back in? And how are you adjusting? And how are you feeling about it? Number 6, reduced endurance and strength. Yeah, I mean, we haven't done much in our recovery, as much as we did when we were at the top of our active selves. So this is a period of inactivity post-surgery, can lead to decreased cardiovascular fitness and muscle strength. But to be honest, if we're really participating in a good physical therapy post-op routine, a lot of this can be negated. And it's just par for the course, and it's just life. Sometimes you get knocked down, you have to get back up. Number 7, psychological barriers. This is a big one for me. I still have a lot of psychological barriers after all my surgeries. Kind of took the wind out of me, and I'm still trying to find my grounding years later. So psychological barriers provide the mental challenge of overcoming doubts about one's physical capabilities and self-confidence. Where's mine? It's gone. It's gone. Can be a significant obstacle. Athletes may struggle with anxiety or fear related to their recovery and performance. I went ice skating this winter, and I was stricken with fear. I sweated so much through all my clothes. I was so afraid that I was going to fall on the ice and break one of my hip implants, which I probably would have. It probably wasn't a good idea to do it, but once I got on that ice, I mean, I had not felt this type of paralyzing fear in my life. And I've hiked on high altitude areas where you're on the edge of a cliff, and done some pretty stupid things in my life. But this ice skating moment, I mean, I felt bad for who I was with, because they were just staring at me what is going on with you? But it was tough. I managed to go around a few times, but I was paralyzed with the fear and the psychological barrier. Number 8, according to ChatGPT, frustrations after surgery, difficult finding the right balance. This is a good one. I call it activity pacing. Striking the right balance between pushing oneself to regain fitness and avoiding overexertion or re-injury can be tricky. This balancing act can lead to frustration if progress stalls or setbacks occur. This is a good one. You don't want to overuse the area that you had surgery on where you're not able to do anything, but you also want to stay active. So it's kind of always checking in with your body to know where you're at with everything, and making sure you're getting appropriate rest and not overdoing it. 9 is adjusting to new limitations. You got to accept that you might not return back to the self you was before the surgery. And your pre-surgery levels, I'll just read it. Pre-surgery levels of performance or may need to adapt to a new physical limitation can be difficult. This adjustment can affect overall motivation and enjoyment. I'm lucky. I feel like I am still pretty active and able to be mobile, sometimes even better than before I had my hip replacements, because I grew up with a hip that never really worked right in the first place. So my situation is very unique. But for people who've had injuries where it's really put limitations on them, or people who I see, who aren't able to walk, or people who've had a stroke, and they lose part of their body. I do feel very blessed that I have a lot of my function, and you should too if you're still able to walk more than 2 or 3 blocks. That's still pretty great after a major surgery like a back fusion or a hip replacement. So that's a tough one, adjusting to new limitations. That's a lot of internal work that we have to do on ourselves. Okay, number 10, this is a big one. Social and competitive pressures. So returning to our exercise or sports, It involves dealing with pressure from teammates, coaches, or oneself, the desire to compete or keep up, with others can add stress and frustration, particularly if recovery is not as swift as hoped. So this is a big one, if you do things like yoga, Pilates, swimming, if you're playing sports, pickleball, softball, even if you're trying to get back into things like CrossFit, and people are like, why aren't you lifting that heavy weight? Why aren't you volleying back the balls as quick as you used to? You got to win that pickleball game. Getting back into the sports, and I think just being able to participate after major surgery is a win. And then everything after that is, what's the word I'm thinking of? Small change. It doesn't matter. And you're going to get more competitive the more you're able to show up. So I think if you're showing up to a sport or an activity that you couldn't do for a long time, and now the surgery has been performed and you're getting back into activity, I think that's a win all in all. So this was just a quick overview of AI produced lists of our top 10 frustrations as a group getting back into our activities after orthopedic surgery. Did I miss one? If so, comment below. Let me know what else you're dealing with in your frustrations after your orthopedic surgery. All right, guys, I will see you soon. I have other lists coming, and we'll keep talking about that. Okay? All right, see you later.